Major depression, major depressive disorder. The major depressive disorder is the most common type of depression across the world. Your doctor might diagnose you with major depression if you have 5 or more of the depression symptoms on most days for 2 weeks or longer. Major depression is sometimes called major depressive disorder, clinical depression, unipolar depression, or simply depression. It involves low mood and loss of interest and pleasure in usual activities, as well as other symptoms, together with 4 or more, mentioned in the previous chapter. The symptoms are experienced most days and last for at least 2 weeks. Symptoms of depression interfere with all areas of a person's life, including work and social relationships. Severities of major depression. A. Mild. Although some of the symptoms and stress are evident, the disorder leads to only minor impairment of social or occupational functioning. B. Moderate. Symptoms lie somewhere between mild and severe. C. Severe. Many symptoms are present. The intensity of symptoms is seriously distressing and unmanageable. In severe major depressive disorder, these symptoms cause marked interference with an occupational and social functioning. Types of major depression. A. Melancholia. This is the term used to describe a severe form of depression where many of the physical symptoms of depression are present. One of the major changes is that the person starts to move more slowly. They're also more likely to have a depressed mood that is characterized by complete loss of pleasure in everything, or almost everything. It is marked by a loss of pleasure in almost all activities, or inability to enjoy once pleasurable things, also called anhedonia. People experiencing major depression with melancholia usually find that their symptoms are worse in the morning. Major symptoms include despondency, despair, feeling empty, early morning awakening, slowing down of movement or restlessness, significant weight loss, excessive guilt. When a patient has a major depressive disorder with melancholic features, they require management from a GP together with a psychiatrist. B. Psychotic depression. Psychotic depression is a term used when the major depressive disorder is associated with delusions, hallucinations, and feelings of paranoia. Sometimes people with a depressive disorder can lose touch with reality and experience psychosis. This can involve hallucinations, seeing or hearing things that aren't there, or delusions, false beliefs that aren't shared by others, such as believing they are bad or evil, or that they're being watched or followed. They can also be paranoid, feeling as though everyone is against them or that they are the cause of illness or bad events occurring around them. Psychotic depression is severe and has a better response rate when treated with a combination of an antidepressant and antipsychotics, rather than just one of these treatments alone. Doctors need to be careful to examine side effects, and sometimes electroconvulsive therapy, ECT, has a better result. It is less common than other types of depression. C. Perinatal, antenatal and postnatal depression. Women are at an increased risk of depression during pregnancy, known as the antenatal or prenatal period, and in the year following childbirth, known as the postnatal period. The term perinatal, which describes the period covered by pregnancy and the first year after the baby's birth. The causes of depression at this time can be complex and are often the result of a combination of factors. In the days immediately following birth, many women experience the baby blues, which is a common condition related to hormonal changes and affects up to 80% of women. The baby blues, or general stress adjusting to pregnancy and a new baby, are common experiences but are different from depression. Depression is longer lasting and can affect not only the mother but her relationship with her baby, the child's development, the mother's relationship with her partner and with other members of the family. Almost 10% of women will experience depression during pregnancy. This increases to 16% in the first 3 months after having a baby.